Today, we're going to delve into a rare but important topic in the world of oncology: leiomyosarcoma. Leiomyosarcoma is a type of cancer that originates from smooth muscle tissue, which is found in various places throughout the body, including the walls of blood vessels, the digestive tract, and the uterus. This rare form of cancer represents a distinctive subset of soft tissue sarcomas, which are tumors arising from connective tissues. Leiomyosarcoma can occur in several locations, such as the abdominal cavity, the uterine smooth muscle, and even the skin. The symptoms of leiomyosarcoma can vary significantly based on its location. In the abdomen, patients may experience pain, swelling, or a palpable mass. If it occurs in the uterus, symptoms could include abnormal bleeding, pelvic pain, or other gynecological issues. Notably, many patients may remain asymptomatic in the early stages, making early detection challenging. As with many cancers, the exact cause of leiomyosarcoma is not well understood. However, certain risk factors may play a role. Previous radiation exposure is one of the more recognized factors, as individuals who have undergone radiation therapy for other cancers may have an increased risk. Genetic conditions, such as Li-Fraumeni syndrome and neurofibromatosis type 1, have also been linked to a higher incidence of soft tissue sarcomas, including leiomyosarcoma. Diagnosis typically begins with a thorough medical history and physical examination. Imaging studies, such as MRI or CT scans, are crucial for determining the size, location, and extent of the tumor. However, the definitive diagnosis is often made through a biopsy, wherein a sample of tissue is removed and examined under a microscope by a pathologist. This process helps to confirm the presence of cancerous cells and classify the tumor type, which is necessary for determining the best course of treatment. Treatment for leiomyosarcoma usually involves a multifaceted approach, often starting with surgical intervention. The primary goal of surgery is to remove the tumor completely, along with a margin of healthy tissue. Successful surgical resection can enhance the chances of long-term survival. However, the feasibility of complete removal can depend on the tumor's location and stage. In cases where tumors cannot be successfully surgically removed, additional therapies may be considered. Radiation therapy, which uses high-energy rays to target cancer cells, is sometimes used, especially if there is a risk of recurrence at the surgical site. Chemotherapy may also be offered, particularly for more aggressive or metastatic cases. Newer immunotherapy and targeted therapies are currently being studied to evaluate their effectiveness in treating leiomyosarcoma, providing hope for more personalized treatment options in the future. Staging of leiomyosarcoma is critical as it helps guide treatment decisions and predict outcomes. The staging system takes into account the size of the tumor, whether it has spread to nearby lymph nodes, and if there are any distant metastases. Generally, tumors are classified as stage 1 through 4, with stage 1 being localized and stage 4 indicating advanced disease with distant spread. Living with leiomyosarcoma can be challenging, as it often impacts not only physical health but also emotional well-being. Support groups, mental health resources, and open communication with healthcare providers are essential aspects of managing the disease. It's crucial for patients and their families to stay informed about the condition and treatment options available. Research into leiomyosarcoma is ongoing, and advancements are continually being made. Organizations focused on rare cancers and sarcomas are working tirelessly to increase awareness, funding, and research into this area, offering hope to current and future patients. In conclusion, while leiomyosarcoma is a rare and complex type of cancer, understanding its characteristics, risk factors, and treatment options is essential for those affected by it. If you or someone you know is facing a diagnosis of leiomyosarcoma, it's important to reach out to healthcare professionals who specialize in sarcomas to receive comprehensive care tailored to individual needs. Thank you for tuning in today. Please subscribe for more educational content on important health topics.